Hi there, this is Danielle Elg, and I am reporting today on certification in wound ostomy and continence nursing. What is wound ostomy and continence nursing? Well, since 1978, the Wound Ostomy and Continence Nurses Certification Board has been certifying nurses. These nurses have the ability to provide specialized care to patients who have the unique needs in the area of wound ostomy, continence, and foot care. There are three main areas of specialization: wound ostomy and continence nursing. And a nurse can choose to apply to get certification for one, two, or all three areas of specialization. What do these nurses do? Well, we have advanced knowledge of anatomy and physiology, microbiology and pathophysiology, biochemistry, microbiology, medical terminology, pharmacology, nutrition, psychology, sociology, and developmental theory. We're able to address the unique needs of the population in preventing and treating wound ostomy and/or continence-related problems. So how does one become certified in wound ostomy and/or continence nursing? Well, to be able to sit for certification exams, you must have a current RN licensure, be a BSN level nurse or higher, and complete one of the two pathways. The traditional pathway, which is the one that I completed when I became a WOCN nurse about 10 years ago, was that I graduated from a WOC education program within the last prior 5 years. The program has to be accredited by the WOCN Society, or the experiential pathway, in which case a nurse can apply for the exams by completing 50 CME hours for each specialty within the last 5 years, and also having 1,500 direct clinic patient hours in those areas. For maintaining ongoing certification, the nurse who has these credentials is responsible to recertify for that specialty area every 5 years. They also must have a current certification, a current RN licensure. And there's two ways to do that, either by exam or by a professional growth program. So a growth program portfolio has to be completed and submitted to the professional growth program for review. How do WOC nurses impact the design and delivery of a culturally responsive advanced nursing care practice? Well, WOC nurses work in a variety of healthcare settings. We use the nursing process to collaborate and coordinate care to achieve optimal results. All populations and ages across the lifespan could potentially need the specialization of the wound ostomy or continence nurse. With special populations that might require a different skill set within these, being neonates, the elderly, obese, dying, etc. Additionally, other considerations that the WOC nurse makes is the ability of a patient to afford recommended treatments, the cultural and family support systems, and personal preferences when we're developing the plans of care. For example, we might have a patient who has a new ostomy and they don't speak English. Based on knowing their cultural and familial background, we know that their family is very highly regarded, so we involve them in the education. Even though the family does speak the patient's native language, we still get an interpreter to ensure that the consistency with the translation. We also look at the patient and not at the interpreter when we are giving the instruction. And we also provide reading materials in the language that they prefer. So on to the impact of meaningful communication in the workplace. WOC nurses have the important role of practicing meaningful communication with patients and the healthcare team. Some of the essential elements of meaningful communication are to be engaged in an active listener, watching for nonverbal cues. This includes being aware of differences within culture, religion, and gender, practicing empathy, seeking clarification when needed, and summarize what the patient is saying. So the WOC nurse impact on communication with the patient, so we can identify barriers to learning, practice empathy and active listening when talking about a diagnosis and plan of care. We involve the patient and the family in the care planning, investigate reasons for not following the treatment plan, and also we want to present in a way that the patient can understand. So when we collaborate with our healthcare partners, we have the advanced knowledge of anatomy and physiology, pathophysiology, and can utilize that when we're speaking to surgeons, physicians, and other healthcare workers. We're also able to sit on committees and share our unique skills with others in the goal of improving quality care and patient outcomes in a variety of healthcare settings for patients around or across the lifespan. We also possess knowledge and skill to educate other team members on evidence-based practices when caring for patients in regards to skin care, ostomies, and continence issues. Additionally, we're able to write comprehensive care plans that address specific needs found on the assessment of individuals. How can mock nurses support leadership for sustained change? Well, it was found that there is a favorable relationship identified with higher rates of nursing certification in the acute care setting, and also there being a lower rate of patient falls, lower hospital-acquired pressure injuries, lower hospital-acquired infection rates, and mortality. So there's a favorable relationship with outcomes based on having more nurses have an area of certification. So an example of sustaining quality improvement initiatives that WAC nurses can do. The WAC nurse is involved in the QI project to decrease hospital-acquired pressure injuries. The nurse participated in the development and implementation of the initiative, as well as the education and integration of it into practice. We also have helped by conducting rounding, provide support and education to the units to ensure ongoing interest. And then we also present and interpret the data that is collected as a follow-up to the improvement project, all of which helps with sustaining quality improvement initiatives. And these are my resources. I want to thank you for listening and learning more about wound ostomy and continence nursing. Have a great day.